Hello and thank you so much for joining us, whether you're watching on TV or online. I'm Anthony Robart. We are waiting for the latest update from Prime Minister Justin Trudeau. That is in about 15 minutes. He will walk out of his home at Rideau Cottage in Ottawa, where he has remained in self-isolation for several weeks. So while we wait, let's look at the numbers, the latest numbers here in Canada and around the world. Globally, more than 75,000 people have lost their lives to COVID-19. But here's a number that's interesting. Close to 300,000 people have recovered from the disease. And there are now more than 1.3 million confirmed cases of coronavirus around the world, with more than 365,000 of those in the U.S. That is more than Spain, Italy, and China combined. You see the number on the screen. New York continues to be the state hit hardest by the pandemic, with about 130,000 confirmed cases. In Canada, more than 16,000 people have tested positive. Now, as we take a closer look at the numbers, the number of confirmed cases in Quebec has nearly doubled in the last 5 days alone. More than 8,500 people infected in that time span. In Ontario, there are now close to 4,500 confirmed cases. Alberta now reporting more than 1,300 infections. Further west, BC now has more than 1,200 confirmed cases, where new cases of COVID-19 appear to be slowing. That is obviously some very good news. Now, here's a number no one wants to hear. Across Canada, 323 people have died. Now, the Quebec and Alberta governments are expected to follow Ontario's footsteps today by releasing projection models on how COVID-19 will, or at the very least, could play out. Quebec's chief medical officer says the projection should help meet the appetite for information that people are looking for. However, he warns the evolving nature of the pandemic makes it very difficult to give specifics. In Alberta, Premier Jason Kenney will present some of the modeling projections in a special televised address tonight. He says the briefing will include when Alberta might reach its peak and how well the province is prepared for that. And some progress to report in Canada's efforts to secure a vital supply of medical masks from the United States. 3M announcing a deal with Washington to allow the export of N95 respirators to Canada. U.S. President Donald Trump, if you recall, had ordered the company to prioritize American demand for the masks, effectively banning shipments north of the border. The company now says it will maintain its exports to Canada and Latin America. All right, let's head to Ottawa now and check in with Mike LeCouture, who is standing by. So, Mike, let's start with the latest numbers from the CERB. It rolled out yesterday, and another day today. So many more people applying. You heard some of the latest numbers. I mean, it's pretty staggering already, isn't it?
It's shocking. 966,000 Canadians just yesterday alone applied for that emergency benefit relief program. And amazingly enough, that adds to the total. And consider this for a second. If you were affected after March 15th, you're eligible for this. But if you even applied for EI, so employment insurance, after March 15th, you are put into that same stream as the rest of the people applying for CERB. And officials are saying that's because we are fast tracking so many of these. We're processing so many of them quicker, that's why we're putting everybody in that stream. It's just more beneficial that way. So consider this for a second. The latest numbers, 3.67 million Canadians are now in that stream. And what I just got off the phone with somebody from the department, and they said they have processed just over 3 million of those claims so far. So it looks like things are going well. And when we say over 3 million, because they have been working on them previously. As I said, anybody who applied for EI has kind of been put in that stream. So we're expecting again today, so now the so-called spring babies, because we had January, February, March people with their birth months yesterday apply. Today, it's the next 3 months you're allowed to apply. We're expecting from the Prime Minister likely to talk about how many have applied so far this morning. Yesterday, we saw those numbers really take jumps. In the morning, he said just over about 200,000 had applied at the time of his briefing. And then around 6 o'clock, there was 600,000, well over 600,000 that applied. We're expecting that number it did jump again to the 966,000 Canadians that applied for this. So we're expecting similar numbers today. as people log on and try and get that done. It's amazing, though, because when you talk to officials and they say, look, we understand that there are gaps. We understand that we may have missed some people, such as students, and that's why the Prime Minister continues to say we understand there are gaps in this system and we will work to make sure that those are taken care of and everybody is taken care of here. But this is something that I think that people need to hear, is that a program like this normally takes about a year and a half to roll out, according to officials. They've done it in 3 weeks. Now, you can say what you want about this government, but this is pretty impressive. The fact that this is an all of Canada, and a Team Canada, for that matter, effort that everybody is saying, and they're able to get this done. So yes, there will be gaps. Yes, there will be deficiencies in it, but the government is saying we're going to work to fill all those in as soon as we, identify them and understand what they are. And because they are just trying to roll this out as quickly as possible, you've heard different officials, financial institutions and different economists say, look, speed is better than perfection. And that's what this government is trying to do as they continue to try and roll this out, Anthony.
Yeah, you've heard a lot of criticism from students, for example, contract workers, so many people, sort of the forgotten ones in this response benefit. And as you mentioned, we'll learn a little more information on that. What else do we expect to hear from the Prime Minister today?
Yeah, I'm hearing that we will hear that he's going to start his speech with a bit of a nod to Boris Johnson, the English or the UK Prime Minister. Obviously he's still in the ICU, so mentioning that. But he will also talk about different partnerships with different Canadian companies to manufacture the personal protective equipment. We know, as you'd mentioned just before coming to me, there is a huge lack of that. So it sounds like there are more companies that are on board with the government and will work with the government to manufacture some of these things, so we don't have to go outside of our borders. The Prime Minister said that all through last week. He wants Canada to be self-sufficient when it comes to PPEs, and he's hoping that process will continue. And it sounds like there will be some sort of announcement in the next few moments when he does finally come out of Rideau Cottage.
Okay, Mike, we'll leave it there for now. We'll touch base in a moment, but let's remind everyone, if you're just joining us, we're waiting for the Prime Minister to speak to the nation, his daily address. There's a shot of his home at Rideau Cottage. The podium is set up, and that is expected in about 13 minutes, give or take. Now, to other news, and for the first time in nearly 3 months, China reported no new COVID-19 deaths today. The daily toll in that country has been trending downwards since the beginning of March. Severe lockdowns, which slowed the progress of the virus in many parts of China, are now slowly being lifted. 32 new cases have been reported across China on Tuesday, all of which were arrivals from other countries. And a different story, however, in Japan, where a month-long state of emergency has been declared. That country's Prime Minister says a spike in COVID-19 cases has forced him to rethink Japan's approach to this outbreak. For months, Japan has been praised for maintaining a relatively low rate of COVID-19 infections. But now, leaders are fearful urban hospitals cannot handle the strain. Let's head to the UK now, where Prime Minister Boris Johnson remains in the ICU. Our Europe Bureau Chief, Crystal Gamansing, joins us now from London with the latest. What do we know about the condition of the Prime Minister at this point, Crystal?
Well, a spokesperson for Boris Johnson did say that he remains in good spirits. He is in stable condition, still in the ICU at St. Thomas's Hospital. We do know that he was given what's being called standard oxygen, but other than that, he is breathing without any other assistance. So we just want to be clear that he is not on a ventilator, but he has been given oxygen. A lot of questions after it was revealed late Monday that he was in fact being moved into the ICU on doctors' advice. Obviously, he is struggling with his COVID-19 symptoms. He had been in self-isolation for 10 days, but still dealing with a persistent cough and fever. And so on Sunday, he was admitted to hospital, Anthony.
So obviously some positive news that he does not have to use the ventilator at this point. Is it safe to assume that his prognosis, given this, I mean, it's a pretty difficult situation, is it good at this point, or is there obviously fear that it could become much worse, isn't it?
Well, from what a number of different medical professionals are saying is that this is sort of progressing how it has in a number of other individuals right around the world, that in some people they'll get the virus, it'll be mild, they'll self-isolate and they'll recover. We saw a number of other high-profile officials sort of go through that process, Prince Charles being one of those individuals who was infected and has recovered. That doesn't seem to be the case for Boris Johnson, who is struggling more and needed to have sort of be in a stepped up level of care, which is what the ICU is. And there he has more access to more specialists, more individuals around monitoring his situation. And we know so little about this virus, right? It seems to, really attack at different ways and different measures depending on who you are. He is 55. People talk a lot about, underlying health conditions. We just don't know what is going to happen, and that is leading to so many questions, and obviously people around the world wishing him well and paying attention to his current situation. And I should note that the Queen is also being kept up to date on Boris Johnson's condition, as he remains in what's being called stable condition in the ICU.
And you mentioned the well wishes coming in from around the world. I want to talk about the other issue. Of course, governance in this set of circumstances. Has anything changed on that front?
Yeah, there isn't necessarily a second in command. However, Dominic Raab, who is the Foreign Secretary, is sort of the second guy unofficially. Prime Minister Boris Johnson yesterday apparently asked him to step in and deputize when he is needed. So he is chairing a lot of the official meetings on the pandemic planning and execution. So that is his second. But everyone is being very clear that it is still the Prime Minister. He still leads the country, although he is obviously in the ICU now. And, part of being in the ICU is you're not seeing people, you're not getting guests or visitors. So he is having to step away a little bit and give up some of the control.
Well, obviously a difficult situation. Crystal, thank you so much. We'll leave it there for now. Crystal Gamansing from London. And in Ottawa, there you see the live shot of the Prime Minister's residence. We're still awaiting the Prime Minister to come out and speak. That is expected in a few minutes. Let's stay in the nation's capital and bring in our Ottawa Bureau Chief, Mercedes Stevenson. And Mercedes, we mentioned earlier that 3M will continue sending N95 masks to Canada following a deal. A lot of negotiations on that front, I imagine. What exactly does the deal look like?
Well, Anthony, basically what's happened is that the White House and 3M have come to a decision, an agreement that 3M can ship masks to Canada and to Latin America. And the way that the Canadian government approached this was to talk to the U.S. administration and say, look, it is in your interests and our interests, our national interests, to ensure that no one is deprived of the resources they need by shutting down that essential trade and movement of goods and people that are supporting healthcare right now. And those masks are hugely important in terms of being able to do that. So 3M will now be shipping those masks to Canada and Latin America. 3M will also be drawing on its supply of masks from China. We know the Canadian government is also expecting a shipment of masks from China this week. We're expecting likely millions of masks to show up, and personal protective equipment and procuring that and Canadian industry contributing is what the Prime Minister is expected to focus on today.
Yeah, you certainly hope whether those masks will be enough, but that is the unanswered question at this point. And, it highlights really the overall issue and the competition, not just for between countries for the protective equipment, but within Canada. Even the Deputy Prime Minister yesterday referring to it as sort of the Wild West. I mean, highlight what's going on there.
Yeah, and I think when she was talking about the Wild West, it was a lot of sort of these countries that are competing in ways that may not be that ethical. People who are literally pirating and buying these masks out from under other countries on the tarmac at airports. These are orders that have already been procured by other countries, and that's where you're seeing that aspect. But within Canada, the federal government and the provinces all have their own orders in. They've sort of been left to their own devices to do this this as they see fit in terms of the provinces, because that is a provincial responsibility. But that said, the federal government is bringing in that stockpile to be able to deliver it to those who need it most. And everything that I've heard in terms of discussions so far between the feds and the provinces have been that everyone is on the same page with making sure that whoever needs it most, whatever province is in the most dire need for those masks, gets them first. And we need an update on that still, which we're expecting to get later today, potentially from the Canadian Medical Association. They're going to be speaking, but they'd indicated last week that some doctors could be running out of personal protective equipment as early as Friday of last week. And they were saying that in particular, Newfoundland and Labrador and New Brunswick were two of the provinces that had the most desperate need for that additional equipment.
Yeah, I was speaking to a friend who works in the healthcare industry, who works at a hospital, and I was asking her how she's feeling. She said, terrified. They're not just terrified right now, but they're especially worried about 2 weeks after Easter, because they fear that a lot of people will not heed the recommendations, heed the orders, and we'll get together, and that 2 weeks later we could see a spike. So that is, of course, one of the big worries. And I suppose this opens up, when you talk about personal equipment, the other industry, the counterfeit, the subpar quality of goods. I mean, is that a fair assessment?
Well, I think that that's something that the Canadian government will very carefully be checking their orders for. I mean, China had volunteered to donate a bunch of masks, essentially to send them, because we'd sent masks to China, and there was some concern about what the quality of some of those masks might be. But the federal government was,
pardon me, I'm going to have to jump in.
By piece to have a look.
The Prime Minister is just about to speak. Let's listen in.
To address recent news coming out of the UK. My thoughts are with Prime Minister Johnson and his family during this time. I've worked with Boris for some time now, and I know how committed he is to serving the people of the UK. He's a fighter, and he will be fighting now to regain his health and get back to the job he loves. Sophie and I and all Canadians are wishing him a speedy recovery. And to our British friends, Canadians, stand with you. We will get through this together.
Every time I hear that someone has been hospitalized because of COVID-19, we're worried. But we have to remember that we're not helpless as when confronted with this situation. And everybody can contribute to the solution of the problem. And you know what to do. Stay home as much as you can, even when the weather is nice and attractive outside. I know it's more difficult here because with the onset of spring. But if we want to have enough chances to be able to enjoy summer in a few months, let's do it. And just go out if you need to go out for groceries, and try and go as little and as few times as possible. And this applies to everybody, wherever you live and what you do, whatever you do. Now, some people are able to do even more than that because they have skills and resources that we need at the moment. For instance, we are offering full-time jobs to reservists of the Canadian Armed Forces so that if our communities need more support, we'll be ready. Health Canada is also recruiting volunteers in order to help our frontline workers. And a few weeks ago, we asked for help to companies for the purpose of manufacturing items which are required, and more than 5,000 companies have communicated with us to offer their help. On behalf of all Canadians, thank you to those companies, and this is really encouraging for us to see so many people willing to contribute.
5,000 Canadian companies have stepped forward to help fight COVID-19. On behalf of all Canadians, thank you for stepping up. As countries around the world grapple with this pandemic, the demand for critical supplies like test kits, ventilators, and personal protective equipment is going up. To keep our frontline workers safe and care for Canadians with COVID-19, we need a sustainable, stable supply of these products, and that means making them at home. With our plan to mobilize industry, we're helping companies retool, repurpose, and innovate to fight COVID-19. We've already signed letters of intent with a number of partners to produce the things we need, and today we have more good news to share. We're working with Thornhill Medical, CAE, Ventilators for Canadians, and a group led by Starfish Medical to produce up to 30,000 made-in-Canada ventilators. These purchases will help increase our capacity to make sure these life-saving machines are made right here at home. We're also working with Nobel Prize-winning researcher Dr. Art MacDonald, who is leading a team of scientists to develop ventilators that are easy to make. And to produce medical gowns and establish new supply chains right here in Canada, we're teaming up with over 20 companies, including Arc'teryx, Canada Goose, and Stanfields. One thing that is particularly inspiring to see is just how many companies are not just producing these goods, but innovating. For example, Autoliv is looking to make medical gowns out of material they'd normally use to produce airbags. En même temps, notre gouvernement continue d'acheter des masques.
At the same time, we continue to buy masks in order to protect our health professionals who are working in an outstanding way. And we have ordered millions of surgical masks with Canadian company, and we are supporting the Canadian Medicom company, which will increase the production of N95 masks. We are also buying disinfectant for hands, and also more than 85 products will be distributed and manufactured in Canada. Some will take more time to be manufactured in Canada, but at each step, we move forward towards getting an increase of our production capacity. I want to thank and congratulate Minister Baines in this regard. I know that many people are worried that there might be a scarcity of these equipments. And yes, if we look abroad, this is an understandable concern, especially if you work in the field of health. We do all we can to avoid any disruption in supply.
Have everything they need to save lives and stay safe. While we're working to secure critical equipment from Canadian sources, we're also in touch with other suppliers around the world who want to sell to Canada. We're expecting 500,000 masks from 3M tomorrow, and we're working as fast as we can to get them to our frontline workers. From the outset, our priority has been the health and safety of all Canadians. So whether you're making medical gowns, delivering ventilators, or treating a patient with COVID-19, we have your back. We're going to be there for you. We also have a 3-point economic plan. It supports business owners, including through new loans, while safeguarding jobs with the wage subsidy and helping those who no longer have a paycheck with the CERB. Yesterday evening, our government proactively shared our proposed legislation on wage subsidy with opposition parties. I know House leaders will be speaking throughout the day to reach an agreement for the House of Commons to quickly pass this legislation, which will give much-needed financial support to Canadian workers while helping employers to keep their staff on the payroll. A lot of work has been done since we announced our plan to subsidize wages. We continue to rely on your input and feedback as we refine it, and we'll have more details to share very soon. Yesterday was also the first day people could apply to receive the CERB. On that note, I want to recognize the tremendous work done by the public service, who processed hundreds of thousands of claims. They're working around the clock to get Canadians the help they need as quickly as possible. And I also want to remind everyone that if you were born in April, May, or June, today's the day you can apply. Finally, as some of you will know, today marks World Health Day and National Caregiver Day. This year, I'm especially grateful for our healthcare professionals and caregivers who are working day and night to keep us safe and to care for our most vulnerable. As Canada confronts this pandemic, many have pointed to our healthcare system as a major asset. Ours is a country where health is a right rather than a privilege, and that's something of which we can all be proud. But our healthcare system is only as strong as the people it employs. Whether you're a doctor or a nurse, someone who keeps our hospital clean, or a home care worker, thank you for taking such good care of us. Thank you for everything you've done over the years to help so many of us start a family, overcome an illness, and enjoy longer, healthier lives. We do not need a pandemic or a special day to recognize your essential contributions to this country, but I hope all Canadians will join me in expressing our deepest gratitude. I hope Canadians honk a little louder when your shift ends today and add another rainbow to their window. Du fond du cœur, merci à tous nos aidants naturels et à nos professionnels de la santé.
From the bottom of my heart, thank you to all of our health professionals.
Des questions par le téléphone.
Now start the question period. Moderator?
Thank you. The first question is from Peter Mazaru from the Hill Times. Your line is now open. Votre ligne est ouverte.
Good morning, Prime Minister. I want to go back quickly to ask you about your decision on March 16th to close the border to foreign nationals. The health minister had been saying for more than a month by that point that there was no benefit really to doing that. It wouldn't keep Canadians safe. You explained your decision at the time by saying that the advice you'd been receiving from public health officials had been evolving. Can you tell us a little bit more about how exactly that advice changed?
I appreciate that your question is taking us back to March 16th, but I'm focused on today and I'm focused on tomorrow. There have been a lot of reflections on what is done in the past, and we'll certainly keep reflecting on that. But everything I'm focused on right now is how to make sure that people are getting the help they need right now, how to keep Canadians safe, how to get through this particular time, and that's what I'll stay focused on.
Follow-up question?
We just looking for some clarity on how exactly the public health advice has been changing, how, the information coming from these officials has been changing and where they're getting it from.
This is a never-before experienced pandemic that is presenting new challenges every single day, new facts, new data every single day. And throughout, we're making decisions based on the best advice that those health officials are giving us. Obviously, this advice is based on modeling, on facts, on what's happening in other countries, what predictions can be made around what might help, what could make a difference. And as that evolves, as the information evolves, of course, we're going to keep adjusting and updating our approach. We've done that from the beginning, and we will continue to do so.
Merci. Prochaine question.
Next question.
Thank you. Merci. The next question is from Christopher Nardi from the National Post. Your line is now open. La parole est à vous.
Good morning, Mr. Prime Minister. I want to come back quickly. You mentioned earlier that a group of companies are going to be teaming up to produce 30,000 made-in-Canada ventilators. Does that mean that you expect that we're going to need to use, at the very least, 30,000 ventilators throughout this pandemic?
What we've said from the very beginning is we need to be ready for any circumstances and every circumstances, and the opportunity to make sure that we have ventilators available if we need them is going to be extremely important. So we have told these companies across the country who've put up their hands to go ahead and get building ventilators as quickly as possible and as many as possible in case we need them in Canada. We certainly hope that we won't be needing all those ventilators, but we also know that there are countries around the world where they are not able to tool up local production to create more ventilators. They're going to be reliant on a global supply that's already stretched thin, and if we end up making more ventilators than Canada needs because Canadians continued to stay social distancing, continued to follow best health advice, that'll be great news, and we will have ventilators to share with other countries that are facing more difficult circumstances. For us, doing more right now, doing quicker right now, is really the only option.
And
Nous
how
reconnaissons.
quickly do you... Oh, sorry.
Juste une seconde. Nous reconnaissons que
on est dans une we recognize that this is a situation which requires of us that we should be prepared for the worst case scenario. And we asked companies in Canada which of them might be able to manufacture as many ventilators as possible and as quickly as possible. We hope that we won't need all those ventilators, but there are countries in the world which might need them even if we have managed to complete, to have a full supply based on our requirements. So in almost all cases, we want to manufacture more and more quickly because this is what people expect.
As a follow-up, I wanted to talk about your wage subsidy program. Yesterday, you mentioned that yesterday you passed bill to the opposition for consultation. Does that mean that a bill and Parliament needs to be reconvened in order for that program to actually go forward?
Much of the wage subsidy is going to be embedded within the Income Tax Act, so that does require us to move forward on parliamentary legislation, and that's what we're talking about right now with parliamentarians.
Merci. Prochaine question.
Thank you. The next question is from Christy Kirkup from the Globe and Mail. Your line is now open. Votre ligne est ouverte.
Good morning, Prime Minister. Has the United States granted a full exemption for its import restrictions, or is the situation with the company 3M a one-off?
We continue to work with Americans. As I've said, we've had constructive and productive conversations that have assured that this particular shipment comes through, but we recognize there is still more work to do. We're going to continue to highlight to the American administration the point at which healthcare supplies and services go back and forth across that border, and it is in both of our interests to ensure that we continue working together with integrated supply chains that move back and forth to ensure that we can continue to protect Canadian healthcare workers while they continue to do the things they need to do to keep Americans safe. Nous reconnaissons à quel point c'est important de continuer.
We recognize how important it is to stress to the U.S. that we have a highly integrated border. It is good news that 3M shipments are arriving, but we have to continue working on our efforts to ensure that the U.S. administration understand that it is in the best interests of both countries to promote the free movement of essential goods and services across the border during these difficult times.
What is the federal government prepared to do if COVID-19 ends up spreading like wildfire in communities like Abington First Nation, or also known as Fort Hope in northwestern Ontario, given its housing crisis, and it's been on a boil water advisory for more than 6,800 days?
From the very beginning, we have been concerned about the potential impact of COVID-19 on rural, remote, Indigenous communities that could be extremely vulnerable because of pre-existing challenges around housing and healthcare, but also vulnerabilities within the population of elders and people with respiratory challenges. That's why, from the start, we've worked with the AFN and with communities across the country to ensure that we're sending more money, more community resources to those areas, and we will continue to respond in every way we possibly can to help those communities that are beginning to deal with COVID-19. We recognize that there are particular vulnerabilities that we need to work very carefully with, and we continue to do so.
We recognized at the outset the extent to which Indigenous communities across Canada might be more vulnerable to the epidemic because of pre-existing issues, because of their remoteness, because of lack of healthcare services in many areas. That is why we have been working with them to make sure that we can provide them with as much support as possible.
Merci. Thank you.
Last question.
The next question is from Manon Cornelier from Le Devoir. Your line is now open. Votre ligne est ouverte.
Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to know, banks have said they were reducing interest rates on credit cards, but that was only for people who could not make the minimum payment, and only for the period in which they couldn't make those minimum payments. So the interest rates, however, continue, or interest, I should say, continues to rack up, and people will come out of the crisis with a far higher debt. Do you think that is reasonable from an industry that posted $45 billion in profits last year? measures with banks from the outset to encourage them to do more to reduce interest rates on credit cards. We are happy that the banks have taken some first steps, but we recognize that they could do more. That is why the Government of Canada is also working on other solutions to give people more access to credit. There'll be more to say on that soon. You have bought blocks of insured mortgages. Will you ask more from banks? Canadian banks depend on a healthy economy and on Canadians succeeding. When times are difficult for Canadians and businesses, the banks know full well they will at the end of the day suffer too. And that is why we are continuing to have talks with them, ongoing discussions that are focused on the need for banks to do more. We recognize they have taken some measures, but there is, of course, more they can do because the crisis is becoming an increasing challenge for everyone every day.
Yesterday, Dr. Tam said one should wear a non-medical mask if physical distancing was not possible, but there's still a lot of confusion about when and where one should wear a mask. Maybe you could clarify for Canadians regarding non-medical masks whether a person is pre-symptomatic or asymptomatic. Should they wear a non-surgical mask when they go outside, even if they think they can physical distance?
I think those are exactly the kinds of questions that people should be taking the advice of medical experts from. I am not a medical expert. What I have heard from medical experts is that the most important thing is for people to stay home. If they do have to go out, they need to keep 2 meters apart and look to go out as minimally as possible. We need to wash our hands regularly. We need to cough into our elbows. These are the things that we know will slow and arrest the spread of this disease through this country. My understanding of what Dr. Tam explained yesterday is that if people want to wear a mask, that is okay. It protects others more than it protects you because it prevents you from breathing or speaking moistly on them. Oh, what a terrible image. But it actually is something that people can do in certain situations. Our focus, though, is making sure that people don't think that wearing masks can mean that they don't have to social distance as much or can go out more often. The advice remains: stay home and keep 2 meters apart.
And also, when your government saw the spread of COVID-19 in China and Asia back in January, did your government start procuring extra medical supplies then? Because it seems that Canada was not prepared and did not secure enough PPEs for our hospital workers.
I think we're seeing right now that the entire world was unprepared to have as much PPE as needed. Some places are facing far greater shortages than Canada. We have worked extremely hard to step up both on our procurement of PPEs, but mostly on increasing the Canadian production of personal protective equipment and materials like ventilators and testing kits. We recognize that this is something that we're incredibly lucky that Canadian companies are stepping up, and in the coming weeks we will have secure supply for many of those products from here in Canada. In the meantime, we continue to work to bring in the equipment that is going to be necessary to keep our healthcare workers protected and our frontline workers protected across the country.
Bonjour, Monsieur Trudeau, Christian Noël de Radio-Canada.
Christian Noël, Radio-Canada. The announcement you made today on respirators, ventilators, when will they be ready? Will they be enough to meet demand? And how can you reassure healthcare personnel who are waiting for them? 30,000 ventilators is a big number. We hope it will be far more than sufficient, because if we needed more than 30,000 ventilators, the numbers would be dreadful. We know that it is best to prepare for worst-case scenarios. That's the responsible thing to do. We know that the ventilators will be ready in the weeks to come. We are continuing to work with the manufacturers to have a better idea of when they will become available in all parts of Canada.
30,000 ventilators is a large number of ventilators, and we certainly hope that we do not get anywhere near that number. But we find it much better to be prepared and to create these pieces of equipment that are going to be necessary in Canada and certainly elsewhere around the world. We foresee those ventilators. There's a number of different suppliers coming in a matter of weeks, some in a matter of months. But we know that creating these is going to be extremely important to be able to handle the future paths of this epidemic.
La compagnie Huawei va nous donner des masques, des respirateurs, alors qu'on est un petit peu en situation.
Huawei is going to be providing masks and respirators, even though things are a bit tense. And don't you feel that there might be a quid pro quo in accepting donations from Huawei, a quid pro quo regarding the 5G network and other issues? We will be happy to receive donations if they meet the needs and standards that we expect, and need for the equipment for our healthcare workers. We will accept donations very openly, and we are not expecting these donations to have any impact on our decisions. In fact, they will not affect our decisions on other issues.
Shipments from many companies in Canada and around the world. We need to make sure that equipment is to Canadian standards, and we will make sure that it gets to the healthcare and frontline workers who need it. That is our priority right now. But receiving goods from a particular company won't necessarily imply at all that we regard different situations with that company any different down the future.
Hi, Prime Minister. It's Annie Bergeron-Oliver with CTV National News. There are a lot of people who are sitting at home right now who are dealing with depression, anxiety, and stress, whether it's because they can't figure out how to pay their upcoming bills, they're dealing with COVID-19 on their own, or they've lost a loved one to the virus and can't have a funeral or a celebration of life. Why hasn't your government done more in terms of mental health support, and what specifically will you be doing for those people?
First of all, we know that the priority has been to get help out to as many people as possible. And with the various measures we put forward, from the wage subsidy to the Canada Emergency Response Benefit, I know that has gone a long way towards alleviating some of the stress people are facing. But people are facing really difficult times at the same time. Whether it's kids who are stuck alone and not able to play with their friends, whether it's seniors who are worried about their own vulnerability, or just Canadians who are really worried about their situation and their future and are feeling alone and are feeling really challenged. We need to be there for each other. That's why, as I said a few weeks ago, reach out if you need help. There are support lines, there are measures in place to give us positive reinforcement and support. But each of us individually can also look out for our neighbors, look out for our loved ones, have more conversations, try to create a supportive system where we're there for each other, where we're going to get through this together. It is a difficult situation, particularly difficult on a number of people. We need to make sure that we're caring for each other, and of course, we have done things and we will continue to do more to make sure we're supporting Canadians through this difficult time as everyone does the things necessary to support our healthcare workers, to keep them safe and to minimize the impact of this disease.
And a growing number of police forces and bylaw officers right across the country are now starting to lay fines and charges to people who are not obeying physical distancing measures. Do you support fining individuals who are not following social distancing measures? And with a number of people now being issued these tickets, does that indicate to you that many people still are not taking this pandemic seriously?
We know that one of the best ways to ensure that this pandemic is as short as possible, is as unserious or as non-consequential as possible, that the fewest number of Canadians die, that our healthcare systems don't get overwhelmed. We need to stay at home. We need to engage in social distancing. That has been the message for weeks now, and it will continue to be the message for the coming weeks. We need to make sure that everyone is doing their part. Recognize that lots of police forces and municipal governments and provincial governments are looking at ways of ensuring that people understand how serious it is. And we, of course, expect people to use good judgment, both on behalf of citizens trying to make sure that they're social distancing and not going out if they don't have to, but also on enforcement officers in terms of applying fines. We're all in this together. We need to get through this together. We need to be there for each other. But we need to make sure everyone's doing their part as well.
So is that a yes or no that you do support?
We recognize that what is essential in times like these is for people to continue social distancing measures, staying home as much as possible. We know that's the best way of getting through this. There are police forces and bylaw officers who are issuing tickets for people who are not applying the directives. I believe it is important for people to be motivated and encouraged to apply the directives, and they need to know their consequences when they don't. Because if those rules and directions are not obeyed, there will be more people dying. But we are asking Canadians to use their good judgment about when to go out and when to stay home, and we also expect our police forces to use their good judgment about issuing tickets.
I'd like to ask you about testing for the virus. What's holding up Health Canada from approving serologic antibody testing? Apparently kits made in Canada are being used in the United States. And I guess more widely, what's keeping Canada from adopting a policy of rapid wide-scale testing to try to get this under control?
As I've said over the past many weeks, rapid, wide-scale testing is an essential part of controlling the spread of this virus. Canada is doing very well compared to many, many countries around the world in terms of the amount of tests that we're doing, but we know we can and we should be doing even better. That's why nationally, every day we're testing more people than the day before, and we're going to continue to ensure that provinces across the country are able to do those tests necessary. The serological tests are also something that is being looked at very, very carefully, tests for antibodies to see who has had coronavirus or not. But we're still in the early days of reflecting not just on the medical implications, but on the societal implications of those tests as well. But we are continuing to pursue every avenue as a way of getting us through this, keeping the numbers of Canadians severely infected to the lowest possible level, and of course, to bringing our economy back strongly as soon as possible so we can keep doing the things that we love to do as Canadians. Nous reconnaissons que c'est essentiel.
We recognize that it is crucial to be doing more screening as a strategy, not only now, but in the long term, to ensure that we control this disease. And that's why every day we are doing more tests than the day before, and those numbers will continue to go up. We are working with the provinces to make sure that everyone can do more, because testing is an essential aspect of the fight against COVID-19. There are a range of strategies. We're looking at antibody serological tests, and we will also examine other avenues to find the best solution for our country, the solution that will get us back to restoring normalcy in the months to come.
Consider early release for some federal inmates to reduce the risk of COVID-19. Just like to know what's happened since then. And Correctional Service of Canada says they're still studying this issue, but there's already cases of COVID-19 inside federal institutions. So what's taking so long to act?
We have taken measures already at Corrections Canada to ensure that we're keeping inmates and corrections officers more safe from COVID-19. But we're still looking at other steps, and I'm sure Minister Blair will be able to have further updates on that in the coming days.
Merci beaucoup. C'est qu'est-ce qui mettra à faire la conférence de presse d'aujourd'hui.
Merci tout le monde. Bonne journée.
That's it.
And that wraps up Prime Minister Trudeau's address to the nation. Let's bring in Mike LeCouture in Ottawa. So, Mike, a number of weeks ago, I guess it's been, 3 weeks now, that Prime Minister Trudeau stood at that exact same spot and put out a call to Canadian companies to help amidst this COVID-19 pandemic. And it seems like many of them have answered the bell. What more do we know on that?
Yeah, saying today that places like Stanfield's and Canada Goose are now going to help to make medical gowns that will help for frontline workers. Talking about a variety of different companies that they've put out the call to, and they have answered that call to try and help with that, saying that 30,000 ventilators are on order now. And the question that came right after that was, well, do you think we're going to need that many? And the Prime Minister basically said, look, we're not sure yet, but we'd rather have too many. And if we get to the point where we don't need them and we can sell them to other countries or send them to other countries to help them, then maybe we can do that. So clearly they're sort of gearing up, as we've been putting it, of Industry Canada to try and get behind this and help with all of this procurement and even making it on our own. The Prime Minister has been saying this for well over a week now. Instead of trying to buy it from other different countries and getting into the issue like we saw with 3M, Canada wants to make it within our borders, try and make sure that we are self-sufficient on the supply of these things, ventilators, those N95 masks, medical gowns, to make sure that we don't run out, so that we're making it here at home. We know, this has been well documented last week. The Auto Parts Manufacturers Association has been retooling some of their members' manufacturing plants to make sure that they're now making ventilators and that sort of a thing. So clearly the call is being answered, and at this point it's a question of how quickly can we get these into service. Clearly the Prime Minister is saying that it looks like it could be weeks for some of those 30,000 ventilators, which may coincide with the peak. It's unclear yet, but that effort is clearly still ongoing, and obviously, it looks like industry is ponying up and doing this when you consider, places like Canada Goose and Arc'teryx, which is a Quebec company that both do winter coats, that are now retooling and making sure that they help in this effort. This is something that we really haven't seen since, the last war.
Yeah, but the big question, and you touched on this, is the timeline, because we are in the throes of this public health crisis, and it's going to take some time for them to come in. Many businesses have answered the call. The question is whether it will be enough, when we need it. And I want to touch on some of the numbers that we heard. Really a startling number regarding the application process for CERB. Obviously, there are many people who still are not eligible. Some changes on that perhaps in the coming days, but close to 1 million people already.
Yeah, 966,000 people applied just yesterday alone, and those are people with birth months of January, February, March. You have April, May, June that are going today, so we could see those numbers just as high. And as we mentioned just before the Prime Minister spoke, upwards of well over 3 million who have applied in general for EI. Those are now in the CERB stream, and over 3 million now have been processed. So the government kind of tooting its own horn there, saying, look, we're doing pretty well.
Yeah, there's no question. Okay, we'll leave it there for now. Mike LeCouture in Ottawa. And let's stay in the nation's capital and bring in our Ottawa Bureau Chief, Mercedes Stevenson. And some news surrounding the proposed wage subsidy, of course. But I want to touch on as well, we talked about the medical equipment that came in, and sort of a question expanding on what we were talking about with Mike and whether we are prepared enough. Janet Silver, our producer, asked the Prime Minister that question. Because, yes, these companies are answering the bell. But the question is, why weren't we, given what is happening or what happened in China and other countries, why weren't we more prepared? He kind of skirted that, didn't he?
Yeah, and it's a question we were asking about testing the other day, too. And I think everyone recognizes the government is trying to do their best here, but there's some serious questions about why there weren't greater preparations. We could see what was happening in China. We could see what was happening in Italy. So was there an attempt to try to acquire the amount of potential masks and equipment and ventilators and tests that Canada might need to do that? Was there enough done in terms of contact tracing to figure out where infected people have gone? And you heard that very first question, too, from another reporter saying, there's been changing public health advice on closing borders, on wearing masks. When you look back, do you think maybe you should have done some of these things earlier? And they are maintaining on that file that, they're always looking back, they're focused on the now, but there are some accountability questions here in the long term for the government. Now, to be fair to them, no government has been prepared for this, and everyone saw it and saw the warnings. But there's still some questions there about whether enough was really done to make sure that that federal strategic stockpile was in place. I think it's a big learning experience for both provincial and federal governments, and it's important for us to point out there that healthcare is actually a provincial responsibility. So while there's a federal stockpile, it's also up to the provinces to make sure that they had the equipment heading into this and to start preparing. And it seems like there may not have been movement as early as they in retrospect would have liked there to be. And there's still questions, because there were still questions about the masks and whether or not to wear them right up until yesterday when Canada's top doctor said, look, if you want to wear one when you're in situations where you can't be socially distanced, not medical masks, just a basic cotton face covering to prevent the spread. And the Prime Minister referenced that too. You can do that, but it's really important you still maintain your physical distancing. You don't touch your face, you wash your hands, all of those kinds of things. But there's certainly some questions there too. There's also questions about China, because the government had said repeatedly that they trusted the numbers coming out of China. U.S. intelligence reports and Canadian sources say that they don't believe that the Chinese were fully disclosing the extent of the pandemic. Did that affect the Western response? And those are questions that we still really don't have the answers to.
Yeah, and the distribution of this equipment is a big issue between the provinces, and you hope that it's going to get to the provinces that need it the most, at least right now. Ontario and Quebec and Alberta saying that their peak maybe weeks away. Of course, we'll be watching that very, very closely. Mercedes, thank you so much. Let's head back overseas and bring in our Europe Bureau Chief, Crystal Gamansing, joining us from London. And Crystal, the Prime Minister was asked about the rapid testing kits. The UK has some experience in this. Not always positive. Shed some light on that.
Well, everyone around the world right now is trying to come up with a way to test more people. There's questions to Prime Minister Justin Trudeau about why you aren't testing enough people. The exact same questions are being asked here of officials in the UK. Now, officials here have ordered all sorts of different kind of tests. There's several different ones. There's the swab one, which we've seen a lot of. There is a antibody test, which is a blood test to determine if you've actually had the virus, and then and then you can maybe go back to work or get back out there, and that's particularly important for healthcare workers. But then there's also this rapid test. But before these items can be deployed in large-scale use, not including the swab test, they have to be tested themselves to prove that they work. And there were some challenges with the rapid test where they were failing at a higher rate than what they would have expected. So in some cases, while there's all of these tools that are out there and some options, they're not necessarily being deployed right away because they need to make sure that they are reliable. So that's one of those experiences that we've had here in the UK, and which is why they're sort of sticking with that traditional swab test. But then we know all kinds of issues there as far as accessing kits and then all of the products needed to process those tests.
Now, before we conclude, Crystal, obviously you are in the UK. You have a lot of experience with what is happening in your country in terms of numbers. And right now, it's fair to say that the numbers are going in the wrong direction. As we look at other countries, Spain and Italy, for example, affected by this crisis a lot earlier than we are in Canada. Is there any indication that those countries have hit or at least are close to their peak and the worst may be behind them?
We continue to watch that, and officials are obviously paying close attention, saying that the increases are not as big as they had been over a larger chunk of time. And it's important not to just look at those day-to-day numbers. That being said, our numbers are going up here in the UK. We know that we were sort of following Spain and Italy, and that's what we're seeing. More positive tests, more than 55,000 individuals infected, more than 6,000 lives cut short. So while there may be a bit of a turn in other places in Europe, that has not happened, at least here in the UK yet.
Yeah, and that's the big problem. I mean, and if people need any reminder of how serious the situation, you just have to look at what is happening to the Prime Minister of the UK right now. And you wonder if this is going to really provide that extra jolt for the people in Great Britain to really stay home and not just heed the recommendations, but the orders.
Yeah, it's not a recommendation. It is a lockdown, and people are paying close attention and maybe a little bit more now with the shock of Boris Johnson. Anthony?
All right, we will have to leave it there. Crystal, thank you so much. Crystal Gamansing from London. So here is a quick recap of what the Prime Minister announced today. Canadian companies are working feverishly to manufacture much needed medical equipment and get them to frontline workers. Canadian companies will produce 30,000 ventilators. 5,000 companies have stepped up to produce other equipment as well. So obviously a pretty big number. The Made in Canada response. 500,000 masks will be arriving from 3M tomorrow. Also on the other front, the Liberals' wage subsidy legislation currently under review by the opposition. As we look at the numbers of CERB, 966,000 people have already applied. That number will continue to rise in the coming days. Well, that is it for us. We really appreciate you taking some time to join us. For everyone here at Global News, thank you again. I'm Anthony Robart.
OK. Bonjour et merci de vous être rejoint à nous aujourd'hui. I know that this is a special time of year for many Canadians, with Easter, Passover, and Vasahi coming soon. We must all stay strong and continue to practice physical distancing. Please stay at home unless you are doing essential work like stocking grocery shelves or working on the front lines of our healthcare system. This year's celebrations will feel very different as all of us find ways to meet with our families and friends virtually rather than in person. But it is absolutely crucial that we continue to follow these rules to protect our families, our friends, our neighbors, and our country. Je sais qu'il s'agit d'un moment spécial de l'année pour plusieurs Canadiens et Canadiennes, avec Pâques, Pessah et Vasahi qui approchent à grands pas. Nous, les Canadiens et Canadiennes, doivent continuer à pratiquer la distanciation physique. Restez forts et restez à la maison, à moins que vous fassiez un travail essentiel comme remplir les tablettes à l'épicerie ou fournir des soins de santé. Cette année, les célébrations sembleront très différentes, mais c'est essentiel que nous continuions de suivre ces règles afin de protéger nos familles et nos voisins. Today, we are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, our Minister of Health, Patty Hajdu, the Minister of Public Services and Procurement, Anita Anand, the Minister of Innovation, Science and Industry, Navdeep Bains, et le Président du Conseil du Trésor,
and the President of the Treasury Board, Jean-Yves Duclos.
And with us is our Deputy Chief Public Health Officer, Dr. Howard New, also available to answer questions. Dr. Tam, please.
Hello, everyone. Bonjour à toutes et à tous.
Hello, everyone.
As usual, I'll start with an update on the number of COVID-19 cases in Canada. There are now 17,063 cases, including 345 deaths. On the lab front, we have now completed testing for over 346,000 people in Canada. Of these, 5% are confirmed as positive. So we are able to track where the spread is occurring. Our greatest worry continues to be the numerous outbreaks in high-risk settings where there is rapid spread of COVID-19, as well as severe outcomes in vulnerable people. These settings include long-term care, hospital, and correctional facilities, but also an increasing number of First Nations and at least one Inuit community. A single case in any First Nations, Inuit, or Métis communities is high cause for concern. These communities are among the most vulnerable to COVID-19 due to distances, access to necessary resources, and underlying health conditions. In response to the heightened risk, I'm heartened to hear of the additional steps that leaders of these communities are taking to protect their populations, and we need to all do everything we can to slow the spread of this epidemic and protect all vulnerable Canadians. We've talked a lot about masks over the last few days, and I want to just make a few very important points regarding mask use. D'entrée de jeu, je répète que les masques médicaux se sont rares partout dans le monde et qu'ils doivent être préservés à l'usage des travailleurs de la santé et autres personnes donnant des soins directs à un patient atteint de la COVID-19. Porter un masque non médical ou un couvre-visage peut représenter une couche supplémentaire pour protéger et de ne pas infecter les autres. Même si vous ne présentez pas actuellement de symptômes. Cette pratique peut aider à réduire la transmission par des gouttelettes de salive projetées par la tousse lorsqu'il est impossible de garder une distance physique de 2 mètres, notamment dans les transports en commun ou à l'épicerie. Par contre, le port d'un couvre-visage ne doit pas remplacer un lavage fréquent des mains et l'éloignement physique. Sans cela, vous ne pouvez pas vous considérer comme étant protégé contre la COVID-19. First, I'm reiterating that medical masks are in short supply worldwide, and they must be conserved for healthcare workers and others providing direct care to a COVID-19 patient. Wearing a non-medical mask or facial covering can be an additional layer to protect and not infect others, even if you're not currently symptomatic. This can help reduce spread of respiratory droplets to others when you can't maintain a 2-meter physical distance, such as while you're on public transit or getting groceries. However, wearing a face covering does not preclude the need for frequent hand hygiene and physical distancing. Without these, you cannot consider yourself protected against COVID-19. But face coverings are not appropriate for everyone or for all ages. In particular, face coverings could present a suffocation risk to babies and children under the age of 2, anyone who has difficulties breathing, and others who are unable to remove the mask by themselves. So thank you.
Oh, sorry. I'm Patty,
okay.
Please.
That's fine. Okay. Thank you very much, Deputy Prime Minister. Bonjour à tous. First, let me say that our hearts are with the families of those who have lost their lives to COVID-19. I want to thank the companies that are working so hard to retool, repurpose, and innovate to fight this disease together. And this is what it means to be a Canadian, coming together to keep our communities safe and strong, to help protect our frontline healthcare workers, and to save the lives of Canadians who become severely ill with COVID-19. And I also want to emphasize, as many others have said here today, that we all have a very important role to play to defeat this virus. As it gets warmer outside, and with religious celebrations like Easter and Passover, Vaisakhi and Ramadan coming, it's important to avoid gathering with others. This means that we're going to have to postpone our barbecues and our family dinners for now. So stay at home. Don't invite others to your house, even if they are members of your own family. Limit your comings and goings. And if you absolutely must leave your house, keep a 2-meter distance from everyone. That's a hockey stick length. And keep using the Canada COVID-19 app to learn how to protect yourself and others. All Canadians have a very important role in getting through this difficult time together. Thank you.
Thank you, Patty. And we will now hear from the Minister of Public Services and Procurement, Anita Anand. Anita.
Bonjour tout le monde. I'd like to reiterate that my thoughts are with those who are suffering and those who have lost loved ones. Alors que nous continuons à travailler dans cette situation vraiment extraordinaire, je tiens à remercier les équipes qui travaillent jour et nuit pour assurer que les Canadiens auront l'équipement dont ils ont besoin. Votre travail est essentiel aux efforts contre le COVID-19 et nous vous en sommes extrêmement reconnaissants. Public Services and Procurement Canada is aggressively and proactively buying in bulk from all available suppliers and distributors, here at home and around the world. I'll take a moment here to highlight some of the steps that we are taking in this regard, both domestically and internationally. Comme le Premier ministre l'a mentionné, une livraison est arrivée de la Chine hier. Nous avons reçu environ 8 millions de masques chirurgicaux et de commandes faites directement par la Nouvelle-Écosse et par le Québec étaient aussi à bord. Nous attendons plus de livraisons dans les jours et semaines à venir. As the Prime Minister mentioned, there was a delivery from China yesterday. We received roughly 8 million surgical masks, and orders made directly by Nova Scotia and Quebec were also on board. We are expecting more deliveries from China in the days to come, as I will describe. The reality is that we are operating in a highly competitive global environment, and international logistics are challenging. We are working closely with our partners around the world, including embassies, as well as with on-the-ground logistics and coordination firms, to ensure that supplies can move from source to where they are needed in Canada right here, right now. With hundreds of millions of pieces of equipment ordered, this is a complex undertaking, even as those supplies arrive in Canada. As the Prime Minister announced late last week, we have entered into an agreement with Amazon Canada, which will use its Canadian distribution network, including key partners, Canada Post and Purolator, to manage the distribution of personal protective equipment and supplies purchased by the government. As part of our efforts to ensure that these supplies are delivered absolutely as fast as possible when they are ready to ship, Amazon is providing these services to Canadians at cost, without profit. En ce qui concerne la collaboration entre les administrations, je peux confirmer que vendredi passé, j'ai tenu mon premier appel de la table ministérielle avec les provinces et les territoires sur l'approvisionnement pour lutter contre la COVID-19. There is strong support for our Team Canada approach to buying in bulk, which we and the provinces and territories consider essential to securing as many supplies as possible in highly competitive markets. We are working collaboratively together, and it is truly heartening to see. Je tiens également à souligner que nous travaillons en étroite collaboration avec les provinces et les territoires pour offrir de l'espace sur nos vols nolisés afin de les aider à ramener leur envoi au Canada. Les commandes de la Nouvelle-Écosse et du Québec d'hier sont des exemples de cette approche collaborative en matière de transport. As an update on equipment ordered, including this order delivered yesterday, we have sourced more than 230 million surgical masks to support the response. Over 16 million have been delivered to date. We have also roughly 75 million N95 masks on order. We expect to have roughly 2.3 million masks in Canada's possession by the end of the week. Amongst other supplies, we have also ordered over 113,000 litres of hand sanitizer, most of which is expected to be delivered this month. We have received 20,000 litres in the past 24 hours and are expecting another roughly 10,000 litres this week alone. On ventilators, as the Prime Minister mentioned, we have relationships with CAE, Ventilators for Canadians, and Starfish Medical for thousands more of these life-saving machines. There is no question that a lot of work is going into sourcing all of these health supplies and many more supplies in Canada and around the world. But I know that the work does not end there. We will not rest until these supplies are in Canada, in our hands, and ultimately in the hands of the many healthcare workers on the front lines of this crisis. Notre objectif est d'assurer que les Canadiens ont l'équipement dont ils ont besoin pour combattre le COVID-19.
To fight COVID-19.
Canadians can be assured that we are doing absolutely everything we can, day and night, in a challenging international context. Merci beaucoup. Thank you.
Thank you very much.
Okay, thank you very much, Anita. And now we will hear from the Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
Merci, Christia.
Thank you, Christia.
Depuis 2 semaines, le gouvernement mobilise le secteur canadien de la fabrication industrielle dans la lutte contre la COVID-19.
Sector in the
We've
fight
seen
against
and
COVID-19.
continue to see Canadian companies across the country making tremendous contributions to our healthcare system. Pour faire face à la crise, plusieurs se regroupent et adoptent de nouveaux outils et de nouveaux objectifs pour innover comme jamais.
New tools and new goals to innovate like never
peuvent
before.
être très fiers.
Canadians should be proud.
To date, nearly 5,000 Canadian companies have contacted us to offer their expertise since our call to action. Nous avons agi rapidement pour lancer un appel à l'action, analyser les lettres d'intention et passer les bons de commande.
And to place orders.
And I'm very proud to see that in a very short period of time, we've helped create new partnerships to secure a supply of made-in-Canada ventilators from Thornhill Medical, CAE, Ventilators for Canadians, and a group led by Starfish Medical. This will allow us to acquire 30,000 ventilators. These companies and partnerships are made-in-Canada solutions leveraging mostly Canadian intellectual property and manufacturing expertise. In creating these ventilator partnerships, we assembled an evaluation panel to run an accelerated due diligence process to expedite the production of made-in-Canada ventilators. And this panel is comprised of health specialists, medical practitioners who have treated COVID-19 patients, engineers, manufacturing specialists, and government officials. We're also working with one of Canada's Nobel Prize-winning researchers, Dr. Art MacDonald, who is leading a team of scientists to develop an easy-to-produce ventilator using off-the-shelf, accessible parts. And the goal is to develop a ventilator model fit for current needs that can be constructed quickly and reliably in Canada. As we've mentioned before, we're also supporting Medicom to boost its domestic production capacity of medical masks, and the goal is to help the company scale up to make tens of millions of masks per year right here in Canada. These steps will reduce Canada's reliance on international suppliers for masks and ventilators, and this is critically important right now. Here's another great example. We heard that our medical workers were concerned about not having enough medical gowns to keep them safe in the front line. The material for gowns has traditionally not been produced domestically, so we needed to find a made-in-Canada solution to secure our domestic production capacity and keep our frontline care workers safe. By engaging with industry and thinking outside the box, we were able to come up with some innovative solutions. And it turns out some materials used for construction house wrap and car airbags can be repurposed for medical-grade gowns. To leverage this Canadian innovation, we're linking up with producers of these materials with apparel manufacturers like Stanfields and Canada Goose, among others, to produce millions of gowns made with newly sourced made-in-Canada fabrics. What I want Canada's healthcare professionals to hear today is that we as a government are doing everything we possibly can to secure the equipment they need to keep them safe in the fight against COVID-19. This is about helping those real-life heroes save Canadian lives. Thank you very much. Merci beaucoup.
Okay, thank you very much, Nav. Et je donne maintenant la parole au président du
I
Conseil
now
du
give the
Trésor,
floor to the President of the Treasury Board, Jean-Yves.
Merci, Christia, et
Yes, thank
j'aimerais
you,
procéder
Christia.
rapidement
I
à
would
une mise à
like
jour de
to
l'état de la
quickly
situation
give you
sur
an
les demandes de
update
la
of what
prestation
is
canadienne
happening with
d'urgence.
the request for
Hier, nous avons
Canada
reçu un
Emergency
total de
Response
plus de
Benefit. Yesterday, we got over
966 000 demandes de prestations canadiennes d'urgence. C'est en une journée l'équivalent de ce que le gouvernement canadien reçoit normalement en 6 mois de demandes de prestations d'assurance emploi. Depuis le 15 mars, plus de 3,6 millions de demandes de prestations d'aide ont été formulées et de ce nombre, 3 millions ont déjà été traités. Évidemment, nous sommes très reconnaissants aux agents et aux fonctionnaires de l'Agence de revenus du Canada et de Service Canada en particulier pour leur détermination, leur engagement et leur travail acharné pour à la fois recevoir et traiter ces demandes. Nous sommes aussi reconnaissants aux Canadiens qui ont fait preuve de discipline hier et nous informons et nous rappelons à tous les Canadiens que ceux qui sont nés en avril, en mai et en juin peuvent aujourd'hui déposer leur demande de prestations canadiennes d'urgence. So I would like to quickly update Canadians on the state of applications for the Canada Emergency Response Benefit. Yesterday we received over 966,000 applications for the Canada Emergency Response Benefit. This is in one day the equivalent of what we typically receive over 6 months in terms of employment insurance benefit applications. Since March 15th, we have received over 3.6 million applications for emergency benefits. Over 3 million of these applications have already been processed. And of course, we are very grateful for the hard work of Service Canada and Canada Revenue Agency workers who have worked very hard, not only to receive, but also to process these applications. We're also very grateful to Canadians for their discipline yesterday, and we remind everyone born in April, May, and June that today they can also submit their applications for the Canada Emergency Response Benefit.
Okay, merci Jean-Yves. Nous sommes prêts à répondre à vos questions.
Thank you, Jean-Yves. We are ready to answer your questions.
Everybody knows the drill. We'll start with 3 questions on the phone before turning to the room. Operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de Michel Lamarche, TVA Nouvelle. La parole est à vous.
Nouvelle.
Oui, bonjour. C'est une question pour le ministre Baines. Je vais la poser en français. Monsieur le ministre, vous pouvez répondre en anglais si le cœur vous en dit. Je veux simplement savoir, pour les fameux respirateurs, ces 30 000 respirateurs qui seront fabriqués ici au Canada, est-ce que vous êtes en mesure de nous dire dans combien de temps, à peu près, on les aura? Est-ce qu'on parle de semaines dans ce cas-là ou on parle plutôt de mois? Pouvez-vous être plus précis?
Oui, merci pour votre question. La réponse est très simple. Je pense avec le système maintenant, nous pouvons acheter l'équipement essentiel dans les semaines. In a matter of weeks, we can see the production of these ventilators for Canadian use and for frontline healthcare workers.
Merci. Une sous-question pour Madame Freeland. On sent que c'est réglé, oui, pour la question des masques de la compagnie 3M avec les États-Unis, mais le premier ministre a quand même laissé entendre qu'il pourrait y avoir dans les prochaines semaines et peut-être prochains mois d'autres problèmes avec d'autres types d'équipements médicaux. Est-ce qu'il y a de la négociation qui s'est faite, Mme Freeland? On sait que les États-Unis, dans certains endroits, ont besoin de ces respirateurs. Est-ce qu'il y a du donnant-donnant? Est-ce que vous avez négocié? Est-ce qu'on est prêt à leur envoyer quelque chose pour nous, en retour, obtenir ce dont on a besoin pour notre personnel médical?
Merci pour la question.
Thank you for your question.
Et on a vraiment eu une bonne résolution avec les masques du 3M. Et je veux remercier surtout 3M et nos partenaires et voisins américains et toute l'équipe Canada qui a travaillé sur ça. Concernant l'avenir, avec nos partenaires américains, on a fait l'argument que nous avons une relation réciproque et très balancée concernant les soins médicaux et les services médicaux. Nous avons une interdépendance et le meilleur résultat pour le Canada, mais aussi pour les États-Unis, c'est de continuer de travailler ensemble. Nos partenaires étaient d'accord et on voit ça avec le résultat qu'on a eu hier. Et on va continuer de travailler avec nos partenaires utilisant cet argument. Et évidemment, pas seulement utiliser l'argument, mais aussi vraiment travailler ensemble. We did have a good outcome yesterday with the 3M masks. It was a real Team Canada effort. A lot of people were involved, and I would like to thank the leaders of 3M who have been acting in a really responsible way, and also, of course, our American partners. We achieved that result by making the case to our American friends and neighbors that when it comes to medical equipment and medical services, the relationship between Canada and the United States is one of interdependence. It is a reciprocal and balanced relationship, and both countries do best when we work together. And that's why we were able to achieve a win-win outcome. That will be the argument that we continue to make and advance in our relationship with the United States in these truly difficult and complicated times. I think it's good news for Canadians and for Americans that that argument resonated with our partners, and we're just going to keep going in that vein.
Merci, Madame la Vice-Première Ministre.
Thank you, Deputy Prime Minister. Next question.
Merci, thank you. The next question is from Teresa Wright from the Canadian Press. Your line is open. Please go ahead.
Good morning. I'm not sure if this is best answered by Dr. Tam or Minister Hajdu, but I'm looking to find out how many ventilators that we have in Canada right now and how many you believe that we will need.
So the actual ventilator capacity are within the responsibility of the provinces, of course, because every day some gets used and some are then they've cancelled elective surgeries, etc., to make sure that there's capacity in the ICUs. From our perspective, we have provided, based on request, ventilators to a whole number of provinces and territories, and we are acquiring more, as you have heard. And so before any requests were made by provinces and territories, we sort of preemptively already purchased another 600, close to 600, and then of course all the innovation and other channels of acquisition also came into play as well. But I think it is an area that you have to monitor in a very dynamic way, because every day there will be people admitted to ICUs, and the availability of ICU beds will be very much based on local epidemiology and how many people are sick in that area. So it's not an even distribution in terms of capacity on any given day.
Okay, and also, Dr. Tam, I'm wondering if you can talk about the science or the data that you've looked at in terms of the demographics of the people who are being most impacted by this illness. You know, I'm talking about, gender, race, socioeconomic status. Are you collecting this data, and what is it telling you?
Yes, we are collecting this information, and the detailed information is actually available on our website. We do know that certain groups are really quite a lot of impacts in terms of severity and deaths, and those are people who are in the older age groups. And so both in terms of deaths a large number, the vast majority, and over like 92% of deaths among those aged 60 or over, and 62% are 80 years of older. And I think that reflects some of the epidemiology we're seeing in long-term care facilities, for example, where the average age of the residents are quite high, and that's why we're seeing that impact right now. And in terms of hospitalizations, again, skewed towards the older age groups. And we know that it has been approximately 60% of hospitalizations are over the age of 60. But we have seen younger age groups being impacted for sure. And with even young people, 20s and the 30s, several of those very tragic reports on people in those age groups also having fatalities. And another way is to track ICU admissions. So we have about, of the case reports that we received, about 5% have been admitted to ICU. I would say overall, the gender distribution, or the sex, male to female, is approximately equal. Another phenomenon to remember is that, in fact, is adults, particularly the working age group, adults who have the most illnesses reported, but the severity of illness is skewed towards the older age groups.
Thank you. Next question.
Thank you, merci. La question suivante est de Micheline Laflamme, Radio-Canada. La parole est à vous.
Next question from Micheline Laflamme, Radio-Canada. Please go ahead.
Micheline Laflamme, Radio-Canada. La parole est à vous.
Micheline Laflamme, please go ahead.
Je croyais avoir touché mon bouton, ça n'a pas fonctionné. Alors, merci beaucoup pour cette occasion de vous poser une question. Donc, le Premier ministre a annoncé ce matin la production canadienne de respirateurs et d'autres équipements. Alors, moi, je me demandais dans combien de temps espérez-vous que le pays va pouvoir compter sur son marché interne that Canada will be able to count on its domestic market to meet its needs for various types of equipment, not only ventilators. Will we always have to count on the international market, and to what extent?
Merci pour votre question. Et notre stratégie est claire. Acheter, 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 bâtir, bâtir, bâtir. C'est une stratégie très claire. Et c'est pourquoi nous avons présenter un plan pour bâtir les respirateurs et les autres équipements essentiels ici au Canada. Quel pourcentage c'est difficile de déterminer maintenant, mais nous allons continuer à travailler fort chaque jour de déterminer les capacités ici au Canada, mais la stratégie aussi pour accumuler l'équipement nécessaire, parce que ce n'est pas seulement nécessaire pour les Canadiens, mais pour les autres pays aussi.
Necessary for Canadians, but for other countries as well.
Merci, Monsieur le Ministre. Michel, en suivi.
Thank you, Minister. Follow-up question.
Oui, d'accord, merci. Et est-ce que le Canada doit se préparer à vivre des vagues successives de confinement pour les 12 ou 24 prochains mois, un peu comme l'Ontario le suggérait la semaine dernière?
Like Ontario was suggesting last week?
Merci pour la question, c'est Dr. New.
C'est
difficile à prévoir qu'est-ce qui va se passer à l'avenir. On a des experts, on fait la modélisation, mais je pense que la chose importante, c'est viser vraiment qu'est-ce qui va se passer dans les semaines prochaines. C'est sûr qu'on attend des bons résultats si tout le monde au Canada continue à pratiquer l'éloignement physique. Et avec la motivation de toute la population, on est toujours dans le même bateau. C'est important et on va voir qu'est-ce qui va se passer au futur.
Important factor, and then we'll see what impact that will have on the future.
Doctor. We'll now turn to the room, starting with Molly from CTV.
News. Minister Anand, you talked about the sourcing of PPE here, those huge numbers, 230 million sourced versus 16 million delivered. Does sourcing mean a guarantee that those are going to come into this country? And then also, can you help me understand a rough timeline when we're looking at, 230 million surgical masks, 75 million N95 masks? When are they actually going to be here? Because we're sitting in a province where the Premier has said we're running out of supplies by next week.
Thank you so much for that question. I want to begin by saying that we are operating in a very fluid and evolving market for PPE. Every single day, we are aggressively ordering in this marketplace, but we must recognize that there are risks posed by fragile supply chains. And there is a fluidity of this current situation that must be understood in this period of exceptionally high demand. In terms of your question relating to supplies and timelines, ordering, of course, does not guarantee a delivery. Ordering means that we have placed an order and contract for products that we need to make sure find their way back to Canada. And in order to make sure that goods find their way back to Canada, we are taking very serious steps on the ground in particular countries to make sure that the product meets the requirements that countries have before they leave the jurisdiction. For example, in China, we have engaged our embassy on the ground in efforts to ensure that our orders are delivered on schedule. And those parties are also identifying new opportunities for us. We are also engaging directly with manufacturers on the ground in China. We are also engaged with private firms who are assisting us with quality assurance opportunities, in-country logistics, arranging transportation, and, for example, assisting us in leasing a warehouse in Shanghai that can store goods once they are sourced and brought out ready to export. Finally, we are arranging our own transportation from Canada. You've been told that 2 planes have already left China and landed here successfully, and we have another one coming this week. And so you can see that these supply chains are complex, but we are taking every effort to make sure that we get those goods back to Canada and in the hands of frontline healthcare workers.
Difficult to give a timeline that
It is difficult, but I will say that we are working on short-term and long-term timelines. And in terms of the short term, we've got 2.3 million N95 masks arriving in Canada by the end of this week. So we are seeing progress on that front.
My second question has to do about EI. I mean, what happens if a person runs out of EI in the coming weeks? Maybe this is Minister Duclos. These people right now can't qualify for that emergency benefit, but we know that the Prime Minister has signaled that that might be brought in, the emergency benefit. Could people that don't have any more EI in the coming weeks be a part of that?
Very good question. And as you know, there are 2 different things happening. The first one is the implementation at a very rapid pace of the Canada Emergency Response Benefit, which initially had the objective of being emergency, not only in name, but also in action. So we knew that what the most important thing to do was to secure the ability of people to make ends meet for those that had no income whatsoever. Now, we are moving into a second stage, and the Prime Minister made it clear yesterday that we're also considering other actions to help other people that may not have lost all of their income, that in fact may be working in conditions where they don't have the income that the $2,000 Canada Emergency Response Benefit would otherwise provide. So there are a number of other situations which we are also considering.
Thank you. Julie Van Dusen, CBC.
For Dr. Tam or perhaps Patty Hajdu, considering this is a global pandemic, when will we know it's over? For example, if we get rid of it here, but it's rampant in some other countries, what would that mean for us?
Thanks, Julie. That's an excellent question, and it ties into what I've been saying all along, which is that we cannot fight this alone as one country, that, in fact, it has to be a global solution, and why it's so important that we work with partners all across the country. And you heard Minister Baines reference that if we don't need all the ventilators, they would go to another country. These are the kinds of actions that I think countries are going to have to take together. If there is one case of COVID-19, then we are all at risk because, of course, even if you think about previous pandemics, hundreds of years ago, they were global pandemics, despite the fact that there was less global travel. Viruses and bugs have a way of making their way around human population. And so the work that we do with the World Health Organization in order to partner with other countries to understand the science together, to accelerate the science and research as a partner country in that organization is extremely important. And I think your question is a very wise one, because in fact, what we see in countries that have crested their first wave is that they have to keep a very close eye on new cases. And until we all have a global solution, this virus will be with us, and we'll all have to work together to prevent its reemergence in any of our countries. Thank you.
Did you want to take a jab at that, Dr. Tam? Considering it's still just one question, though.
Yeah, no, I think that's precisely the case. So Canada will try extremely hard, as we have been doing, to reduce this first wave. But the global population is not started off being completely not immune to this virus, completely new. So until the global population attains a certain level of immunity, we will continue to see this virus having the ability to hit any country. So this is a really important point in terms of international collaboration. Finding those solutions like treatments and vaccines, of course, will be really, really key in the coming months. And any time that we can buy for that to actually occur is absolutely crucial, because if global solutions are not found, this virus could potentially continue to circulate for some time. We actually don't know, as Dr. New said, that we actually don't know what will happen, after the first wave and in the months to come, because there's different possibilities as to whether this virus then becomes more entrenched in the human population, like influenza, whether it would undergo mutations. So all of these things are unknown at this time, but every country in the world is affected now, and none of us will be able to manage this without coordination.
So considering all this talk about masks, and I'm talking about cloth masks, do you, Dr. Tam or Patty Haidu, plan to wear one when you grocery shop, when you can't do physical distancing, considering that so many of us could be positive and not know it?
Yes, I think if I'm going out and I can't maintain physical distancing, absolutely, that's one option, because I want to protect others, recognizing that actually the evidence is not quite there, but it is an added layer of prevention and protecting the spread to others. Again, it's not necessarily there to protect myself. I think I have to have that reality check, and the fact that I have to still do the hand washing and still do the physical distancing as much as possible. I think that is, reasonable and feasible advice.
Thank you, Dr. Mike. No question.
No, absolutely. If there was not a way for me to practice social distancing, I wouldn't hesitate to wear that, and with the direction of Dr. Tam in terms of how to do it properly, and being very aware that it would be a new experience for me. I haven't worn one yet, and so I would probably feel like I would want to fiddle with that mask given the newness. And I think that's one of the risks about wearing a mask, is to wear it properly and to understand that it is for many people who haven't worn one before, an uncomfortable experience, and that there'll have to be some self-awareness around the tendency to want to adjust it. At this point, I haven't had to wear a mask. I have been able to practice social distancing without one.
Thank you, Minister. Operator, over to you.
Thank you. Merci. The next question is from Maura Forrest, Politico. Your line is open. Please go ahead.
Yes, thank you. I think this is probably either for Deputy Prime Minister Freeland or Minister Anand. I just wanted to get some real clarity around this question of masks coming in from 3M. So we understood from the Prime Minister that there are 500,000 masks from 3M coming in tomorrow. But I just want to be very clear. That's not to say that we have a full exemption from the White House at this point. And I guess further to that, are there other shipments coming in of N95 masks from the U.S. this week?
So just to be clear, and the statement that 3M put out yesterday was very clear. 3M has received clear assurances from the government of the United States that shipments to Canada will continue unimpeded. As the Prime Minister said, we are expecting a shipment very soon of 500,000 masks, and we have more shipments directly from 3M to come. Now, we do have other pending shipments from other sources in the United States, and we are working collaboratively with our American partners to be sure that those shipments also can make it to Canada, just as our American partners are working collaboratively with Canada to ensure that the medical supplies and services that the United States depends on from Canada can continue to flow to the United States. I don't know, Anita, if you want to add anything?
I would just like to add that it's a full court press on procurement right now. So when a situation crops up with regards to supplies coming into Canada, whether it be from the United States or any other country, we work diplomatically and we work collaboratively, but we are aggressive in terms of ensuring that the supplies make their way back into Canada. And that's why I described that situation with China, and Christia has done a wonderful job talking about the United States, but it really applies to every country that we are determined to make sure that supplies get back to Canada once they are ordered and procured. And that is our main task, and we won't stop until we get it done.
See, Nav wants to add something. Go for it now.
Thank you. I'll be fairly brief because I think it's important to note, as we recognize, as Anita has said and Christia have highlighted, that of course there's strain and stress on our global supply chains, but that's why we're also looking at Made in Canada solutions that look at domestic sourcing as well. So the key thing to highlight for the ventilators that are built in Canada or the gowns that are made in Canada, for instance, that were announced today, those source materials, those raw materials are also part of the local supply chain as well. So this further insulates us for any potential challenges that we may see in the near future. So I think that's an important aspect of when we talk about Made in Canada. It's not only the final product, but also the raw materials that go into building that final product.
Thank you. Minister Mora, follow-up?
Yes, thank you. And Minister Anand, you mentioned 2.3 million N95 masks coming in this week. Can you say where those are coming from? And also, you said you'd ordered 75 million masks. I think that works out to about 3% that are supposed to come in this week. That seems very low. Do you realistically think that we're going to be able to fill that full order of 75 million masks?
Thanks for the question. Let me start off by saying that talking about the supply chain and the stresses on the supply chain at the current time requires us to be sanguine about the numbers, but also realistic. I can assure you that now that the 3M shipment is coming across the border and will arrive tomorrow. I can also assure you that we have a plane that is going to leave China this week with another shipment of N95 masks on it. Apart from that, I won't be able to, and I'm sure people here will agree with me that we are in an era of volatility in global markets. And so every step of the way, we are making sure that the supply chain can function as it should. And where we see shortfall, we will be definitely relying on domestic supply chains to be ramped up and providing equipment to Canadians so that we have complementary supply chains operating at the same time, both domestic and international.
Thank you, Minister. Operator, next question, please.
Thank you, merci. La question suivante est de Hélène Buzetti.
Next question is from Hélène Buzetti,
La parole
Le
est à vous.
Devoir.
Oui, bonjour. J'aimerais revenir à cette question des masques, Madame Freeland. Vous nous aviez dit plus tôt la semaine dernière, je crois, que 3M était un fournisseur très important pour le Canada. Mais j'aimerais savoir, existe-t-il d'autres entreprises américaines qui nous fournissent de l'équipement médical de manière significative? Et pour ces autres entreprises, ont-elles obtenu la même exemption de 3M qui leur permettra de continuer à nous approvisionner?
Merci pour la question. Oui. Bien sûr qu'il y a des autres entreprises américaines qui sont des fournisseurs importants pour le Canada. Et on continue cas par cas de travailler avec ces fournisseurs et avec évidemment le gouvernement américain.
En suivi.
OK, donc j'en comprends qu'on n'a pas nécessairement obtenu la même exemption. Monsieur Duclos, je voulais juste revenir à une question posée précédemment par une collègue sur la question de l'assurance emploi. C'est une question à laquelle je cherche une réponse depuis longtemps. Donc, quelqu'un qui est déjà sur l'assurance emploi et dont les prestations viennent à échéance maintenant ou d'ici quelques jours, ces personnes-là ne trouveront probablement pas de travail dans un court avenir, malheureusement. Peuvent-elles, ces personnes, appliquer à la prestation d'urgence?
Mais comme je l'ai dit en anglais tout à l'heure, puis je suis heureux de le répéter en français, Mme Buzetti, il y a deux objectifs absolument importants qu'on a suivis dès le début. Le premier, c'est de mettre en place la prestation canadienne d'urgence pour répondre aux besoins d'urgence de centaines de milliers. Et maintenant aussi, ce sont des millions de Canadiens qui n'auraient pas eu autrement aucun argent pour joindre les deux bouts. Alors, c'est ce qu'on a fait rapidement. La deuxième chose que M. Trudeau a annoncé hier, c'est que l'on est dans une étape d'aller plus loin parce qu'on reconnaît que ce gigantesque filet de sécurité sociale laisse passer malheureusement quelques personnes à travers certaines de ces mailles. Et M. Trudeau a déjà annoncé hier qu'on travaille activement sur beaucoup des cas que les gens ont en tête, dont celui des cas de gens qui seraient en voie de perdre leur prestation d'assurance emploi.
Merci, Monsieur le ministre opérateur. Prochaine question, s'il vous plaît.
Next question, please.
Oui, merci. La question suivante est de François Carabin du Journal Métro. La parole est à vous.
Journal Métro. Go ahead.
Bonjour. Ma question s'adressait particulièrement à Madame la ministre Anand. Donc, en fait, je me demandais, là, bon, on parle beaucoup des demandes d'approvisionnement en équipement qu'on a fait depuis la semaine dernière, entre autres, à l'extérieur. Vous aviez mentionné, je pense que ça fait exactement une semaine, en fait, là, mardi dernier, qu'il y avait des commandes, je pense, de 60 millions de masques qui avaient été faits à l'intérieur du Canada. Je me demandais, pour la province du Québec, êtes-vous capable de dire combien de masques sont arrivés en date d'aujourd'hui ou en date d'hier?
Merci beaucoup. Ça, ce n'est pas seulement une question pour moi, mais aussi pour peut-être ministre Haidu ou Dr. Tam. Je voudrais dire que quand nous avons commandé des masques, c'est aussi nécessaire de montrer les fournisseurs et les investissements médicaux essentiels pour assurer que les biens vont arriver en Canada. Pour le Québec, je voudrais demander à Dr. Tam si elle a quelque chose à ajouter.
Nous avons une entente avec toutes les provinces et les territoires et l'entente spécifiée la quantité de medical supplies.
Medical supplies.
Oui, seulement ajouter, c'est Dr. New, que la situation, c'est toujours fluide. On ne peut pas vous donner des chiffres exacts parce qu'au fur et à mesure, on reçoit toujours des livraisons d'un jour à l'autre. Et comme le ministre Haidou a aussi constaté, on a déjà commandé une entente, même un cadre d'allocation entre le gouvernement fédéral avec toutes les provinces et territoires pour assurer qu'il y a un mécanisme pour donner l'équipement essentiel au fur et à mesure, comme c'est nécessaire, dépendant s'il y a un foyer ou une région plus touchée d'une partie du pays que l'autre, on est toujours prêt comme un pays.
So we are always ready as a country to meet those needs.
Monsieur Carabin, en suivi.
Mr. Carabin,
oui, donc j'en comprends que, bon, évidemment, la demande peut changer de jour en jour. Mais jusqu'à maintenant, depuis, disons, la semaine dernière, là, au moment où vous avez fait des commandes importantes, avez-vous un chiffre du nombre que ce soit des masques, que ce soit des respirateurs, d'équipements qui est arrivé dans chaque province? J'aimerais justement une précision sur le nombre au Québec. Est-ce que vous en avez un?
Moi, personnellement, non. Je pense que peut-être c'est plus une question pour les autorités au Québec parce que c'est eux qui reçoivent l'équipement essentiel et peut-être ils ont des chiffres plus adaptés que nous autres. Mais moi, personnellement, on sait, on continue à travailler étroitement avec nos homologues de toutes les provinces et territoires, incluant le Québec. Et c'est quelque chose, c'est une bonne collaboration. On continue avec le travail ensemble.
Merci, Dr. New. Ceci met fin à la conférence de presse pour aujourd'hui.
Je pense que Anita veut ajouter quelque chose sur ce point.
Un petit, Mathia.
Yes, I just wanted to say.
J'ai mis en place un engagement régulier avec mes homologues partout au pays afin de m'assurer que toutes les régions, le Québec inclus, ont ce dont elles ont besoin, y compris les fournitures et l'équipement médicaux. Donc, c'est important que Québec est à la table avec tous les autres et nous discutons régulièrement ces choses.
And we regularly discuss these issues.
So I just want to
Tam wants to add something to
I just want to remind everyone this is World Health Day. This is la Journée mondiale de la santé, and today we are recognizing the incredible work of nurses and midwives. Donc merci à toutes les infirmières et les sages-femmes. Merci.